Wooden, and my presentation is on Community Anti-Drug Coalitions of America and Medicine Abuse Among the Youth. Traditionally, the focus of the community and prevention programs has been on illegal drugs and substances that mainly stemmed from the war of drugs philosophy. However, it has been increasingly evident that medicine abuse is a growing trend that affects not only adults but also youth. Prescription and substances like cough syrup are easy to get, they are legal, and in many cases are already present at home. Furthermore, adolescents can trade these medicine substances freely and in general have much easier access to it. In some cases, youth get very creative in what substances they use. The recent example is a use of cough syrup to get high, and cough syrup is very easy to get. Nationwide, it is estimated by the recent Monitoring the Future survey that nearly 7 million people nationwide abuse prescription drugs. When it comes to youth, the nationwide estimates is 1 in 10 between the ages of 12 to 17 who abuse cough syrup, and 1 in 5 who abuse prescription medications. When it comes to prescription medicine abuse, the statistical data shows some troubling trends. While it is not as prevalent as alcohol, for example, it is one of the growing categories, and for that alone it deserves a lot of attention. Similarly, nationwide statistics by state varies a lot as well. Where some states report higher prevalence compared to others, California reports 175,000 use. While there are many alcohol and other drug prevention programs operating in the United States, the Community Anti-Drug Coalitions of America is not only among the oldest ones, but also among the largest. Not only it has presence in all states, but it also operates on an international level as well. The Community Anti-Drug Coalitions of America vision is a world of safe, healthy, and drug-free communities, and its mission is to strengthen the capacity of community coalitions to create and maintain safe, healthy, and drug-free communities globally. This particular prevention organization serves wide segments of population and offers numerous programs. It focuses heavily on prevention, education, and awareness. The programs are tailored for numerous population segments, including youth. Additionally, this organization tries to pay a lot of attention to low-income minorities and disadvantaged communities. There are numerous programs that are offered, such as Ambassador Program, Tobacco Initiative, International Vet Corps, and most importantly, Medicine Abuse Awareness. This program focuses on educating the American public about the rise on youth medicine abuse, and specifically, it tries to educate individuals and communities about raising frequencies of using and abusing over-the-counter cold and cough medicine. The funding for Community Anti-Drug Coalitions of America comes from a variety of sources. It is partially funded by membership fees, as the program has memberships in all states. Additional funding comes from federal and private funds. Many of these resources are channeled down to the local coalition members that can apply for yearly grants that could be over $100K and can be renewed up to 5-year periods. The program faces some barriers, specifically when it comes to federal funding. According to a report by the Coalition for Health Funding, overall funding for public health programs has been drastically cut over the past 4 years, and it's adversely affecting Americans in a direct way. Federal agencies that deal with substance abuse prevention and treatment have been affected the most. The program tries to raise more funds by relying on private grants and membership fees, but federal grants constitute a large proportion of its budget. The organization has a strong ethical stance. Beneficients are the entire organization's goal is to help others, including both individuals and communities. Stewardship is the available resources are used only for organizational needs and are also distributed among local coalition members to provide help at the local level. Competence is the organization that has National Coalition Institute that offers courses to improve members' knowledge base and training. Among these sources is one of ethics called Ethics for Prevention Specialists. This course is designed for local partners. Honesty and candor, our local coalition members, individuals, and communities are treated with respect. The information is not withheld from any of them, and the organization is very proud of its transparency when it comes to its operations. According to the CADCA 2013 report, the impact varies depending on a specific coalition member. At the national level, educational events are encouraged and promoted. There will be one nationwide event this October. It includes town meetings, Twitter presence, webinars, and so on. The organization also offers courses for coalition members. The problem is that for certain states there are no specific results posted, so only results provided by other coalition members can be used. For example, these are results from a coalition member in Kentucky. Measures that were taken included installed a permanent drop box at the sheriff's station and restricted pain clinics and eliminated doctors shopping at pill mills. Here's the data from the same coalition member. The example includes medicine abuse by adolescents, and it shows that the instances have given greatly reduced because of the local coalition members' efforts. The organization can do more to improve its impact and performance. First, data is very hard to find, such as, for example, I was unable to find results and impacts for some states on organizations' websites. The impact has to be easily found and clearly stated. When working with youth, it has been shown that youth ambassadors can be used to address issues on the ground. The program has a look and feel that is somewhat outdated and not appealing to the youth. The website is old, crowded, boring, and has too much information, and is hard to navigate. The organization can use celebrities to work together and to make youth more interested in programs being offered. It should also have larger and more prominent social media presence. At the same time, it is definitely plays a big role in the larger public health arena as it works with youth, works with minorities, low-income communities, and proactively addresses new areas. Example, the use of cough syrup. And here are my references. Thank you.